Hello and welcome to Dental Health Matters, brought to you by the BSDHT. I'm Rhiannon Jones, President of the BSDHT, and today's episode is a special edition of the podcast, hosted by James Cook, Managing Editor of The Probe and Smile Oral Health Matters. In this episode, James leads a forward-looking conversation reflecting on the key developments that shaped UK dentistry in 2025 and exploring the opportunities and challenges facing the profession in 2026. He's joined by myself, along with Simone Rosario, President-elect of the British Society of Dental Hygiene and Therapy, as we discuss collaboration, scope of practice, skill mix, leadership, and what meaningful progress really looks like for dental hygienists and dental therapists. It's a thoughtful and future-focused discussion about where we are now and where we're heading next. I'll now hand over to you, James, to get started.
Hello and welcome to Dental Health Matters. I'm James Cook, editor of The Probe and Smile Oral Health Matters, as well as the Probe Dental Podcast. And today I'm delighted to be joining you here on Dental Health Matters to speak with BSDHT President Rhiannon Jones and BSDHT President-elect Simone Rosario. Thank you for joining us today. How are you both?
Very well, thank you.
Really good. Thanks, James.
So we're here today to discuss some of the major milestones and development in UK dentistry throughout 2025. We will reflect on the progress made across policy, education and clinical practice and explore how these changes shape the future role of dental hygienists and dental therapists. We'll also be looking ahead to what is next for the profession in 2026. So I wanted to start by setting the scene somewhat and begin by asking you each what stands out as the defining developments in the UK dentistry this past year. Why does it matter to dental hygienists and dental therapists?
Thank you, James. I think I'll take this one first. I think one word comes to mind when I think back over the past year, and that's collaboration. It's been working with people, whether that is during consultations at government level, at strategic level, and even at a smaller internal level, just that feeling of really being part of a team and taking on board other people's viewpoints. And it culminated actually with a very successful collaboration with another society, the British Society of Periodontology and Implant Dentistry, where we hosted the Oral Health Summit in November. And I think it's something we're very proud of, because it can be quite difficult to get people to work together. It's not always easy. Everyone's busy. A lot of the roles are voluntary as well. It's a big ask for people. But I feel that there are steps towards teaching people together at an undergraduate level so that there's shared care, and we work together every day in our teams, but we don't learn together afterwards. So we have conference for dentists, conference for dental nurses, dental hygienists, dental therapists. Actually being able to bring people together and collaborate in that way has been brilliant, and also being a major stakeholder in discussions that are going to involve the future of dental hygiene and dental therapy, with the 10-year plan from the NHS, working with the Office of the Chief Dental Officer in the Four Nations. So being able to be invited to have a voice, to have a seat at the table has been a really big thing, I think, for us in 2025.
And just to add on, I mean, Rhiannon's hit it right on the head there about collaboration, but just really being aware that, you know, things are changing, and the way we work within dentistry and within oral health, things are shifting, and really being able to have the right skills, the right mindset has been really instrumental in being able to see and work alongside these coming changes. So it's been an interesting year.
Absolutely. And just to circle back to the Oral Health Summit as well, just wanted to put it out there that it was an absolutely incredible event. For anybody who missed out, you know, you really did miss probably, I think it's in contention for event of the year, certainly from my point of view. It was fantastic. It was worth the trip to Edinburgh. So I wanted to move things along and talk a little bit about scope of practice and professional identity. There's been sort of continued discussion around scope of practice and the evolving responsibilities of the dental team. How do you see this landscape progressing, and what does it mean for professional confidence and autonomy?
Thank you. People will probably know that the scope of practice was revisited this year by the General Dental Council. It is limited to a degree by the Dentists Act, an Act of Parliament that says what they can and can't do and what we can and can't do. So there are still limitations. I'm sure people were expecting or hoping for maybe bigger changes, but there are reasons for that. I have to thank everybody for including us. So the BSDHT were instrumental in all of the meetings leading up to it, the consultations. We had ample opportunities to feedback on what we thought. We are the voice of the members. There may only be 1 or 2 seats at the table, and we have to represent not just our members, but in doing that, we're representing every dental hygienist and dental therapist in the country, because they're going to have to work under these new guidelines. So there are links to it in our website. You can look it up on the General Dental Council's website as well. But it's that growth, really, isn't it, of where we can think a bit differently about what we do, what our patients need. We work in very different settings. And in fact, some of us work in various settings throughout the week. So what we might need in an NHS dental practice could be very different to what we need in a private one, or if we're teaching in a hospital. But we do need this governance of a scope of practice. But I think the landscape has changed, and I think the trust that people have in our profession, because we have been slowly adding to that scope of practice over decades anyway, and there's never really been an issue with it. So I think that's what I've seen, is that inherent trust in that we'll always do what's right by the patient, and that they can trust us to take on additional duties. But we need support, and some people need mentoring, and people need training or revisiting skills they maybe learned as an undergraduate but would need to revisit if they wanted to take on a new role in the future. So the landscape is evolving all the time, but I think people like us, societies and associations that look after members, can actually give the confidence and help them build a bit more autonomy within the dental team still.
Excellent. And just to kind of expand on that, wanted to talk about skill mix in real practice. There's often a difference between policy intention and the day-to-day reality. What have been the most significant steps forward in enabling effective skill mix in 2025, and where do barriers still remain?
So with regards to skill mix, we know we've been hearing that term, really float around for some years now. And for us, and again, kind of circling back around to the work that Rhiannon has been leading with ministers within the political space, within the OCDO, we're really wanting to ensure that we are at that table and being involved with that. But one of the things that we really wanted to highlight around this point was that actually each registrant group, it means something different. And what does it actually mean? What does skill mix really mean for each registrant title? And I think that's really an important step, and we're moving in that right way and ensuring what does that look like? Because you're right, policy has an intention, but the actual delivery to day-to-day working, I am fortunate enough to work in an environment where we utilise all of the various registrant titles, mainly our dental nurses that have additional skills, myself as a dental therapist alongside my dentist colleagues. So it's really been fortunate for that. So I can see that coming into play. But when we think about the barriers, we wanted to highlight here was really about what is best practice, because we know that each kind of pocket within the dental team and the oral health team, they've got some learnings that we could all share. And I think that is something that we really want to kind of pull down and break down and work, as we said earlier, collaboratively across the registrant titles in seeing what best practice looks like. How has that been effective in your space? And then how can we bring that back in so that we can see that in reality? So those are really, when we think about the barriers, is trying to pick and work alongside our colleagues, and really bring that best practice into general practice.
So when it comes to exemptions and prescribing progress, many listeners will be following the ongoing work around exemptions. Could you share an update on where the process currently sits and how the BSDHT is currently continuing to advocate for safe, clear and workable change?
So first of all, we'll correct that term about prescribing, because the exemptions legislation doesn't allow for dental hygienists and dental therapists to prescribe. In June 2024, when the legislation was passed, it allowed us as dental therapists and dental hygienists to work without a prescription, as we know, but then to administer and to supply certain medicines that have certain requirements over them, and there'll be what we call in acronym POM, which is prescription only medicines. So they are generally prescribed, but by having the exemptions legislation, it allows us as dental professionals to work without that prescription, to use these medicines in our day-to-day work. So if we go back to 2013, when direct access was passed through, dental hygienists and dental therapists were now able to work independently without a prescription for the work that we do, but we had a restriction around the medicines that we could use to effectively work day to day, whether it's administering local anaesthetic, applying fluoride, and supplying fluoride to our patient groups. So this legislation has allowed us to be able to work more autonomously. With that, though, there is additional training that my colleagues need to do. And so when the legislation came through, alongside that, training was afforded and developed. And there's free access to online training through NHS England. And it does allow our colleagues to work both within the NHS setting and within the private setting. But it is really important that if you are working under the exemptions legislation, that you've done the additional training. Otherwise, you would need what you would call a PGD, which is a prescription that has been overarching, which is signed off by a pharmacist to allow you to work without having a prescription. And so that's really kind of like the top line. But the key thing is that when you are using these medicines, that you are not prescribing them. And that is really something that we really wanted to get across to the profession, to our members, that you are administering, whether it's local anaesthetic or fluoride, and you are supplying that. So if you already have a label, there's like high concentrated fluoride toothpaste and varnishes that you can dispense to your patient groups, but they have to be pre-labeled already, because we can't write a prescription for our patients to go and get them from their pharmacist. So that was really what we wanted to kind of get across as well to the profession, because we do get quite a few inquiries around exemptions. What does that look like? How do they apply it? So those are the big things. I don't know if there was anything else Rhiannon wanted to add on that.
Only, I suppose, one of the member benefits is that you can go on our website and we have quite a lot of documentation on there, frequently asked questions, almost like a little workbook that one of our colleagues put together. So I think that's a good place to start. Links to all of the courses that are possibly available in your own countries as well. But also you have the inquiries line. So if you do have a very specific query that you can't find the answer to, then please email us and we'll do our very best to answer you. Thanks, Simone.
I'm really glad you brought up education and training, because we wanted to speak about education, training and leadership. As the profession evolves, so too do expectations around clinical leadership and professional development. So what types of training or CPD do you believe are becoming increasingly important?
It's a really good question, because as somebody who used to be an educator herself, I can see the difference from when I trained in the 90s back to then when I trained in 2013. So going back to university, leadership had become a little bit something that we were taught. And then more recently, undergraduates are all taught about leadership, more in a clinical setting. But I think that can only be a good thing going forward, that clinicians understand leadership, whether that's just them on that day in that clinic and they're leading that day list, as it were, or whether they're leading the hygiene team perhaps within their practice, or they have a huge group of practices, maybe they're a manager. So there's levels of leadership, and I'm very encouraged to see that it's partly come from the General Dental Council in what they expect somebody to graduate, what knowledge they would expect them to have. But that doesn't help people like me, who've been around for 100 years, understanding what leadership actually is and how that can look. It could be that you're a mentor and that you're leading on an individual level. It could be that you're part of policy making and that you're leading in that sense. So seeing the opportunity, I think, where it lies for leadership in the first place. And then that helps you help others with regards to training, because what we can see, and we talked about it earlier on in the interview with the change in landscape, change of scope of practice, more autonomy. The 10-year health plan actually names dental therapists as possibly running the neighbourhood care centres, as in the dental side of it. we need to make sure that people are ready for that, because if you're going to take on an NHS list of people who haven't been for years and years, the cases that you're going to see could be quite complex, people who haven't been for a long time. So it's, from an organisation like ours, we need to be prepared for that as well. And we can't imagine what they need. We need to go out and ask them. We need our members to feed through to their regional groups. Their representative then feeds through at council level to us at executive level, and we can decide how that fits in the strategy and what that actually looks like. But we can only imagine that's going to be quite a lot of clinical skills required. So depending on what practice you're in. So what I'm noticing is that at one point I didn't do many extractions, because we, by the nature of the clinic that I work in, we see people so regularly, the preventive care was in place. So we actually didn't do many extractions. And then along came the pandemic, a big interruption in care. A lot of my patients were special needs, so they were quite scared to come back into care as well after, what had happened. And I suddenly started doing extractions. I needed a mentor. I used to teach it. And yet only a year or 2 years of not doing it, it's that recognising whether you feel that your training was suitable, whether you feel competent, whether you feel confident. And it could be that your training was sufficient, but it's been a long time since you've done it. So I think from a society's perspective, we really need to look at what people need. And I think more than lectures and webinars, which people find very valuable, and the articles that are written, podcasts like this, it's actually clinical skills. That's what we're hearing from people now. They want courses where they can come and actually practice it and get some hints and tips that wouldn't have been given at undergraduate level, but we can do at a postgraduate level. So I think that's been a really important thing for us. And that's a real member benefit, that you can tell us what you need and we can develop that for you, because providing skills to the profession is one of our 3 main pillars of promoting health, preventing disease, and providing skills. And then also think about working policies, and that there is the sort of what we think of that we need all the time for our training, as in CPR and information governance and things like that. But it's also important to think about what your workplace might need as well, and in what nation you're in as to what the requirements are. So it's just a little reminder that we can provide skills, but you might find there's even more that requires your attention as well. But to always be aware of the policies of where you work.
And we've obviously done a lot of looking back and reflecting during this podcast, but looking forward to 2026, what are the BSDHT's key priorities, and what message would you like every dental hygienist and therapist to carry with them into the coming year?
Great question. Okay, I think if I answer, I'll give a key priority, I think, to begin with, and that is looking inward a little bit at our society and just seeing, is it fit for what's coming? I think there has been a lot of change in the last year. I've only been in post for 1 year, and I'm surprised at how much has changed in that time. The landscape is changing. The attitude towards utilising the team fully, I feel it's not just words anymore. I can see that people are trying to do it. I feel listened to. Not that I ever wasn't listened to, but I feel like it's moving forward a bit more than it was. So I think we need to look inwardly at ourselves and see what works really well, but also future-proof the society. Be ready for what's coming next. And that means being ready for our members as well, listening. It possibly means a little bit of restructuring and making sure it's really fit for purpose. So I think that's probably one of my key priorities as the current president. And then really, what message would I like every dental hygienist and every dental therapist? I think after doing the Oral Health Summit, it's looking for opportunities. Be brave. It was scary. It was a scary thing to bring as an idea. Just like this podcast, you won't know unless you try. And sometimes you have to put yourself out there and be a little bit uncomfortable. And yet, I think reaching out to other people and getting other people's opinions and ideas is invaluable. So if you're not doing that already, if you don't already have a dental hygiene and therapy community that you're part of, whether it's just contacting the other ones that work in your practice or using your regional group and actually reaching out to people and asking them, use the group for what it's there for, to support you and be your voice at a national level as well. So just be brave and look for opportunities.
And really, just to build on the key priorities, obviously Rhiannon and I are always trying to think of what's next and what does the society look like. And we really wanted to just get across that we are a society that wants to be proactive. We don't want to just be reactive. We are really trying to be a progressive society. And so for us with that, it's about us hearing from the profession. Yes, we are a membership organisation, but we really want to hear from the profession as well. What's happening on the ground? What are your pain points? What can we do as a professional society to support you in your working environment? So that is kind of like our key, well, one of our key priorities on top of all the mountain other things. And then I would say, as a message that I would love for my colleagues to land with and hopefully take into 2026. And I say this quite a lot, and Rihanna's probably ear chewed off with it, and we've used it a lot. And it's about having a growth. Just we only had 1 year as president and president elect together. She's got another year of me, and I would just like to say, like, for us, it's about having that growth mindset and having that flexibility. So even actually in line with what Rhiannon said about being brave, to be brave, you have to have a growth mindset. You have to be agile. You have to be flexible. And especially with the changes that are coming, you have to be able to move that way. We cannot be using in my day or we used to do it like this. It's about what is now. And we're moving into another century, into another decade, and we need to be able to flex with that. So that's one of my kind of messages. Have a growth mindset.
And finally, to wrap things up, as a call to involvement, for members who want to support advocacy work but are unsure of how to get involved, what would you encourage as a first step?
You've got to get involved. You have to. I'll be a bit provocative here, but we've just talked about all the things that have happened, the changes in the scope of practice, all of the sort of the skill mix and being utilised properly. That doesn't happen by accident. No one else is out there advocating for us. It's your societies, your organisations, your associations. They are the ones with a seat at the table and the voice and having to be heard. And it's not easy. So actually, I think if you appreciate these changes, you have to be willing to step forward, whether that's volunteering or just being involved in the consultations. When we send you an email and say, you can answer this consultation as an individual, do it. Because if you sit on the fence, you're going to get splinters. Choose one way or the other to do it. And if you're glad and grateful for what we've managed to do, maybe you could step forward and actually help. Now, that could be just at a regional level. You find out where your local group is, join, ask if they need any help. You don't need to be a committee member. They would love to have your help. And create this little community, get yourself a voice. But there's also loads of other working groups within the society. But I think I never thought I'd be in this position. These things grow and they grow legs, and then you get encouraged by other people and you see the true altruism of people when they really want something and they can see that maybe it doesn't make a difference to them, but they know it'll make a difference to a lot of people. And ultimately, the people we care for, the patients who receive care from us, this is what it's all about, being the best that we can be. So I am sure I've forgotten something, so I'm going to hand over to Simone for this.
Absolutely not. No, I think you've really nailed it exactly as we see this. That call to involvement starts with each and every one of us. And like you said, Rhiannon, if we weren't involved and volunteered and served in regional groups level, or even had an idea, or if there was a thought, a passion that you have, whether it's in education or even research, there's loads of different working groups that people could get involved with, whether it's even around diversity and inclusion. There's different aspects within the society that we love to have people share their thoughts, share their experiences, because as much as we think of the now, we are actually paying it forward for the generation after us as well. So we've come up and we're now being able to stand on the shoulders of those that have gone before us because of that altruistic attitude, because of that volunteering mindset. And we're hoping going forward that the next generation and those within the profession now will also carry on with that baton as well.
Brilliant. Well, I can think of no better place to leave this conversation for now. Rhiannon and Simone, thank you so much for your time and for joining us and sharing your reflections and insights. It's clear that 2025 was a year of meaningful progress as well as continued challenge. And the contribution of dental hygienists and dental therapists remains essential to the future of oral health in the UK. To learn more about the BSDHT's work, upcoming events and ways to get involved, please visit bsdht.org.uk. Thank you.
This episode of Dental Health Matters is supported by EMS. As a global leader in preventive dentistry, EMS is committed to elevating patient care through innovation and education, and shares our dedication to supporting dental hygienists and dental therapists in delivering the highest standards of practice. We're grateful for their partnership in making this podcast possible. So, Harry, I'm really delighted to have you here today, and I'd like to introduce you to our listeners. This is Harry Morris, the General Manager for EMS UK and Ireland. So we really want to know more about your company and what you can offer patients and also the clinicians who are looking after them. So I suppose to start with, what's new in the world of EMS right now?
Yeah, thanks, Ren, and thanks for having me on the podcast as well. It's nice to be here, and yeah, I mean, what's new at EMS? I mean, the big thing this year was the GBT Summit. So we've run GBT Summits in the past, so it's not necessarily new, but this one certainly felt a bit of a momentum change, a bit of a difference. You know, it kind of doubled in size, and the format of the day was a little bit different, which we found a little bit more to be a bit more engaging, and the energy at those events is always really high, you know, and it's nice to be at those because we worked so hard on those all year. And as you know, like with this oral health summit that you're doing, you put a lot of energy into making it as best as it can be for delegates, and you hope that people come, and then once they come, hope they enjoy it and feel part of it, because that's what we want at the summit, is to reflect what we want really with GBT as an overall, is for people to feel part of it, you know, a community, not just watching it. You know, we didn't want it to just feel like people are just watching speakers on a stage, watching these people talk about their lives. We wanted it to feel as interactive and as a community as we possibly could, and I think we got that pretty good this year. So that was a big high of the last couple of months for sure.
That's great. And actually, as you'll know, sometimes dental hygienists and dental therapists can be isolated in their working practice. So actually having a community of people that they can contact who are doing things in a similar way to them it can only strengthen things, can't it?
For sure, and I think that's definitely, and I think people have the same struggles and also the same wins, but the struggles is tough because I think it's always not just for dental hygienists and dental therapists, I suppose all of us, that you think you're the only one going through it. You know, so when you put everyone in the same room that has something in common like dental hygiene and has a passion for prevention, and you have 250 of them, you realise really quickly that everyone's going through very similar struggles in their practices or with their patients, and you can feel that kind of relief that they're not on their own. And you see it as well. You see it on social media. You know, you see it on the forums. People kind of, the same things come up every day. You know, and you see that, and it must be difficult for them. You know, real tough, especially if you're the only, which is normally the case, dental hygienist in the practice.
On any one day, yeah. So a practice could have 4, but they don't actually see each other. So actually, I think for any of us, no one wants to be out on their own. No, we all want to be part of a herd or a group. And actually just have it working on the same ethos, the same structure is really powerful and helpful for people as well.
Yeah, for sure, yeah, it's nice. And you see it here as well at the Oral Health Summit.
Yeah, brilliant. So I'm wondering, because your company always seems to be updating things and bringing things out, are there any new services or products that you want to highlight?
I think the big thing for us is we are purely about prophylaxis. You know, that is all we do. So all of our research and development, all of our investment, all of our, everything goes into prophylaxis, and we've never really got distracted by anything else. It'd be very easy for EMS to bring out a brand of whitening, to, bring out, different products, or, it'd be very simple for us to do that to a market that we already have, and probably get and be quite successful in those markets. But they've never wanted to get distracted. They've always wanted to make sure that they are bringing out the very latest innovations in prophylaxis, and that's always worked nicely, and so much so this year as well. So in March at IDS, we launched the GBT machine, which is the upgrade on the Airflow Prophylaxis Master. And the data it gives the clinicians and the practices, when used correctly, can be huge. And that's a tough thing. It's not, it's difficult to explain, but data is so powerful. And the more data you have, the better you're going to be able to offer your patients. Yeah, it's going to be really nice. And then we can link the education to that as well. So we can tailor education needs to, if someone is really, using P's-on a lot, that might be that they're not quite getting the airflow side of things.
Or not as confident.
Not as confident, so then we can tailor that. If someone, for example, big one is, PerioFlow. If someone's not using PerioFlow, that can be, going subgingivally with that. It can be, some people aren't so confident with it. And we can see, well, they're not using PerioFlow at all. Then we can automatically tailor that education to suit them.
And I think I used to be a lecturer, and we teach people to be a safe practitioner.
Yeah.
But they still listen to what we taught them. So actually to come out, if they're lucky enough to go straight into a practice that has all of this equipment, I can understand why they would be anxious. They want evidence.
Yeah.
And data is the evidence they would need. So yeah, I can see how this would drive people to be more confident to use it when they've got hard numbers and fact, because that's what we've taught them.
Yeah, exactly, yeah.
So I just wondered, you've talked about education already for practices and individuals, but I'm just wondering what else your company does with regards to supporting the profession from an educational point of view.
Yeah, I mean, education's always been huge for us across EMS, but in the UK as well, especially, we're really lucky. We have the Swiss Dental Academy, which is our sister part of the business, and they take care of all of the education side of things. And we're really lucky. We have some incredible trainers that are out there talking about guided biofilm therapy, and we started when I joined EMS. We had 6 incredibly passionate STA trainers who are dental hygienists, dental therapists. Now we're up to about 22 of those, and we're training about 1,200 clinicians a year in GBT, guided biofilm therapy, and it's just a fantastic part of the business because there's so much energy, so much joy, so much passion in there. Yeah. But the big one is the reason why that's grown so much is we're offering in-practice training. So we go into a practice and we take a whole day, and we try and encourage the whole practice to attend. And this is usually after they've invested in equipment, but they can have it before. There's no reason why you couldn't, but generally most people that go for this option are investing in the equipment. And the people that are just looking to find out more tend to come on one of our more like central courses where people come to us. But the in-practice ones are fascinating because it's a big thing to close your practice for a whole day.
Huge.
And we don't just ask, huge investment, and we don't just ask them to close it for the hygiene room, we ask them to close the whole practice so that everyone's there for the training. Because we're not just teaching them how to use airflow, we're teaching them how to prevent as a practice, and how hygiene should be at the core of their business. And we need everyone there for that. Everyone's got to be on board. The front of house team need to know, obviously the dental hygiene team, but the practice owner, the associates, everyone needs to understand how important this is for the practice. And when we have one of our STA trainers there who are still working in clinics, still doing this on a daily basis, explaining to them why it's so important, it just transforms.
And their passion is infectious.
It's so
You
infectious.
can tell that people that are using this. And if you don't mind me saying, some people might say it's not new in that we've always done some form of guided
For sure.
biofilm therapy. It just didn't have a name. But I think it's the structure that we've got very used to working in a structure, whether it be a flow chart, a series of guidelines, and that's that's how I see it, is that it's this lovely, it takes the pressure off us every day if we have that structure we can follow, that has evidence behind it, a huge following as well, and that community support. It can only be a good thing. So I'm thinking about 2026. Where can people come and talk to you? Where can they find out more about this? How can they contact you? What events will you be at?
So we're going to go quite big at Dentistry Show in Birmingham at NEC in May. We want to make that more of an experience show. I think trade shows are really difficult, now. There's a lot of them, and people are going to different events and different CPD lectures, and everything at EMS we want to be an experience. We want them to come away and think, wow, that was great. Whether that's calling my office to order some powder or coming to a GBT summit, the idea is you come away thinking, that was nice. That was a nice experience. And we're really trying to go big on that dentistry show. So we're trying to make the stand a little bit more of a area, I suppose, and then you come in, and then within that experience there's going to be drinks and food and live workshops where you can try the equipment, learn, and there'll be different workshops as well. So there'll be maybe like a P-Zone workshop, and then there'll be an airflow workshop, and we'll do that. And then there'll be more kind of entertainment, so like live podcasts. Brilliant. My entire life at EMS, I've gone to events, and I've gone to dental practice, and I've gone to education events, and every dental hygienist and dental therapist say pretty much the same thing to me. I love this, but how do I can't convince my team to be on board. And I always say the same thing. You don't need to convince your team to be on board. We do that. And just come to one of our events, have us come into your practice. We will bring your team. We can convince your team. You just need to convince them to get in touch, because like I said before, I want everyone that gets in touch with EMS to think, yeah, that was really nice. That was really enjoyable. I really enjoyed that chat with Harry or Irina or Amy. That was great. Whether they want to introduce it or not, it should be a positive experience.
I want to be a little bit provocative maybe here, in the sense that you and I have known each other a long time. I know, like you say, making every contact count in a positive way. I know I can come and ask you anything, but I'm quite a confident person. Not everyone is, and they will have heard things about the product or maybe about GBT that they don't fully understand. So I think if you had the opportunity to bust a few myths that are out there, what would you want to say to people? What's the most common problem?
There's kind of two I suggest. I mean, I think the first one, it obviously is the price. I think that's a big one that people talk about, because we are a premium product, and not necessarily the first investment, but I hear a lot of concerns over the maintenance of the equipment. But we've done a lot in that area, and I think my big message to people, often when people are unhappy, they come and talk to me, and then I explain some things, and then normally it's resolved really quickly. A little bit of understanding, a little bit of potentially some new training, but we have a lot of practices out there now that use our equipment. There's a huge amount, and sometimes people can maybe hear of one or two bad experiences, and then that can sound
always, because they never
really
write
loud.
about the good experiences.
But there's for everyone.
So the connectivity that you're talking about, that goes with that data. That's going to really help as well. Isn't it
really helps. Yeah. And then I think the other big misconception about EMS or guided biofilm therapy or GBT is that we're trying to be divisive. Which we never mean to do that. We never want to come across that if you're not doing guided biofilm therapy, you're doing it wrong. We never mean for that to happen. We are the biggest, advocates for dental hygienists and dental therapists. And I'm so passionate about it. I've spent the last nearly 10 years convincing practice owners how important dental hygienists, dental therapists are. And been quite successful at it as well. And that's what I want EMS to be. It's super inclusive, and we are for the industry, and that's the big message I feel that I want to get out there. We really are for the industry. We're not here to take your money and run. No. We support, we educate, we advocate, and the whole point behind things like the GBT Summit is to be that inclusive and to get everyone together and raising that voice, similar to what you guys do, the BSHC, and that's why that's why we come here and we sponsor it, because we want you guys to have as much of what you need to do what you need to do. When a dental hygienist comes to me and says, we want this, I'm like, okay, well let's do this for you. That really is my
in your
and my
setting,
team's
in
drive.
your abilities.
It is. When a practice owner buys a unit, a GBT machine, and adopts GBT into their practice, I don't think, oh, great for me. I really do think the hygienist can be so happy. Yeah, and the team does as well. Like I say, all my team are dental hygienists who have experienced this. The passion is for the hygiene, for the hygienist. It always has been, and I love that.
You might be selling health to the patient, but it's giving the passion back to the clinician as well, isn't it?
Yeah, and it really is that, and we do celebrate that. We really do.
You should. Yeah, you should.
So I think that's the big misconception, that the EMS are out there to get what they want, but we are, I think, the biggest givers in that area that we try to be, because that really is the passion of my team as well, more than me. They really are passionate about it.
You can see it. Oh, thank you very much, Harry, and also thank you on behalf of our society for the support that you give us. I think they'll see that you attend events for us and things, but there's so many other things that you provide for us, helping us go to other events as well, because we're a small society in that way. So sincerely, I thank you for everything you've done for us as well.
No, great, thanks, Fiona. Thanks for having me on.
You're welcome. We'd like to thank EMS for supporting this episode. Their dedication to advanced science-backed biofilm management and minimally invasive hygiene care helps raise the standard of practice. Through their support of BSDHT, EMS helps us put prevention, professional development, and outstanding oral health outcomes at the heart of everything we do.
Hello, it's Simone Rosario, President-elect for BSDHT. This episode's member question has asked, they've just started working after graduating and have been struggling to find clear guidance on how long to wait before patients can have supra and or sub PMPR treatment after having surgery. There seems to be varying guidance depending on the type of surgery, and most guidance refers to elective dental treatment. But studies are done on extractions, restorations, etc., and no specific guidance on hygiene or dental hygiene treatment. They wanted us to provide some kind of support and guidance on this. Here is our response to this member inquiry. Unfortunately, there isn't a set document in existence that is specific to hygiene treatment. However, we went out and we spoke to various colleagues who were really helpful in being able to share some insight into this. They suggested that essentially there is very little reason to delay PMPR longer than a few weeks. It does depend on the type of surgery that the patient has had, but most blood vessels reinthrise after a week, and there's no real risk of blood clots forming or bacterial endocarditis or wound infection. The risks are probably higher if you leave excess biofilm behind, as the bacteremia from eating and brushing is higher. We strongly suggested that if they are in doubt, that they should consider contacting the patient's own medical professional for their view. The medical professional will have their own opinion on how things should be managed when looking after and sharing care for this particular patient, and will know what's best for the patient. There is no one-size-fits-all approach to this, and there isn't a standardised written document either. We suggested that non-surgical periodontal treatment would be classed as elective treatment. We also suggested that depending on how soon after the surgery the patient should return for treatment, would be best practice to request that the patient consults their surgeon or consultant and has a scanned copy of their response sent to the practice, so this could be added to the patient's file. We did apologise that there wasn't a straightforward answer to the query, but in some way we felt that this would help them be encouraged to know that they could work closely with the medical team that the patient has been with and have best practice going forward. We're pleased to say that our member was really thankful for the information that we provided, and it is always delightful to be able to support our members with their inquiries, especially when there isn't a standardised response back. If you have a question for a future episode of Dental Health Matters, do get in touch at bsdhd.org.uk/podcast.
That brings us to the end of today's episode of Dental Health Matters. Thank you so much for listening. I hope you found today's conversation helpful and informative. If you enjoyed this episode, please remember to subscribe, leave a review, or share it with someone who you know might benefit. See you next time.